world has changed since the NHS was founded in 1948. The shape of the population and our lifestyles have changed. New drug treatments and technology are continuously being developed, and quite rightly, people expect more from the NHS. We have traveled around the country to hear the case for change. Firstly, let's look at the shape of our population. By 2029, the number of people aged over 85 will have doubled. We spoke to a family doctor in Crawley.
It is essential that the NHS focuses heavily on getting the services right for the elderly population. We spend 40 to 50% of our budget on the elderly. For Crawley, it is about 70–80 million pounds. We have to do that in an integrated way. We should be looking at disinvesting from sickness and investing in health and well-being. We should have a single point of access for services for the elderly, which should be easy to use, and we should also have people who help them to steward through the services.
So what about our lifestyles? How have they changed, and what impact does this have on the way we deliver healthcare? We went to Middleton in Greater Manchester to find out.
In this area, we tend to find that people are getting less active, physically active, and they're also starting to eat on the run as well, which is having a detrimental effect on their weight. Because of obesity, not being as active, they're getting a lot more infections, which we're treating on a day-to-day basis. We're also finding an increase in the rates of diabetes, coronary heart disease, incidence of stroke, which is having a big long-term effect because these conditions, once developed, need lifetime monitoring. Medication cost goes up, number of follow-ups go up, the input from secondary care goes up. So overall for the NHS, it is quite resource-intensive and labour-intensive as well.
So we have heard that the changing shape of our population and our less healthy lifestyles are having an impact on the way we deliver healthcare. The next challenge is to make healthcare delivery more equitable. There are marked differences in the life expectancy depending on where you live in the country. Let's go to Heaton Park for a graphic example of this.
We're standing in Heaton Park, which is in the centre of Manchester. To my left-hand side, we have Bury and Prestwich, and men's life expectancy in Bury and Prestwich is 3 years longer than in Manchester, which is to my right. The key reason is poverty. In Bury, we have a very affluent population on the whole, where in Manchester, in Crumpsall in particular, we have large pockets of deprivation. When people live in poverty, they often don't have the financial means to buy products needed for a healthy lifestyle or to buy into services that will give them a healthy lifestyle. It means that we've got to narrow that gap, and in order to narrow that gap, we need to give information in an appropriate and sensitive way so that people can make choices and decisions about their own lifestyle independently.
Inequalities are not just socio-economic, but they are also about access to the right treatment in the right place at the right time. We spoke to one of the country's leading stroke specialists about this in Oxford.
As things get more technically involved, it's absolutely necessary to be in a place where the very best technology can be brought very, very close to the bedside. You've got 24/7 coverage, you can get the very best people always accessible, and you can't do that in lots and lots of places. You have to do it in places where you concentrate the activity so you can make it available to everybody, but in one specialised place. We have spent the last few years getting stroke treatment right. If we see the patients within an hour or two, and we get the patient into a hospital where the specialist technology, we can get a scan straight away, we can do something about it.
Increasingly, people are used to having access to a range of services and information 24/7 to fit with their busy lifestyles. We visited a walk-in centre at Manchester Piccadilly station to find out more.
I think it's important that the NHS does adapt really to the changing needs of society. I think the expectation of people, certainly in Manchester, is to have easy access to healthcare services. We're open 7 to 7 Monday to Friday. People can just walk through the door, they don't have to make an appointment, and they can just drop in and they can see a nurse or they can see a doctor.
Our visit to NHS Direct proves that there is an increasing demand for access to the NHS around the clock.
The demand for the service is huge. We handle about 500,000 calls per month.
So have you noticed any change in the colour of your skin, any jaundice at all?
We have about 2 million visits to our website every month, and that continues to increase at about 30%. And obviously there's significant utilisation on our digital TV. About 2/3 of our demand is out of hours.
Finally, there is one more fundamental change that is driving us to change, and that is the rapid development of new drug treatments and new technology. We visited a pharmacy in the east of Oxford to hear more.
Medicines have changed probably more in recent times than any other time. There's continually new developments in drug delivery systems. More medicines are specifically designed for certain diseases and certain illnesses. And it means that people can be treated at home. They can treat themselves once they understand their own diseases. There's no longer need for specialist treatments within hospitals, apart from maybe the setting up.
To look at new technology and its impact on the NHS, we visited Southampton to talk to a heart specialist.
The technology side of treating patients has changed enormously during the time that I've been in clinical practice. Over the past 10 years, there's been even greater acceleration, both in terms of the scope of the interventions we can do and also in terms of the way in which we can manage patients outside in the community. An important area of development is remote monitoring. You will be aware that there are many patients who have pacemakers to deal with both fast and slow heart rhythms. Low pace burden, that's good. We are now able to check on the functionality of those devices remotely without the patient needing to come to hospital.
So as we have seen, there is a strong case for change if we are to provide a quality health service for the future.